James Oro had no idea he was HIV positive until October this year, when a medical check showed that his CD4 count was down to 9. Oro said he has always tested negative, though he suspects he might have contracted HIV in 2009.
I had a cat because I had washed the clothes, and I had a cat around here. So after, then they called me, head of science, there is a boy dying there. So I rushed to give him first aid. So I remember that's how I must have acquired it.
Doctors instructed him to start on antiretroviral treatment on 29th October, but before he could start, Oro suffered a meningitis attack.
It begins from here, follows, and then gets me from here. Then comes on this side. So even if I take very many Panadols, no change. I use the robe to reduce the pain, no change. So now that doctor referred me to Mulago Hospital.
So meningitis is an infection of the layer surrounding the brain. And so that gives you the headaches. Somebody doesn't want to look into light because they have a lot of pain. That gives you, and then the lining of the spinal cord and the lining of the brain all sort of get infected. And so somebody complains of neck pain or neck stiffness.
And though the attack was serious, it was a blessing in disguise for Oro, because according to new research, when one is HIV positive and has meningitis, they should first treat the infection before they start the ARV therapy.
Once patients have this infection, you need to, as they start their antiretroviral drugs, their immune system begins to improve. And as the immune system begins to improve, it obviously then wants to respond against the fungus or the bacteria that they have. And so what ends up happening is that those responses by their cells or their immune system sometimes will be exaggerated. And in a sense, they will turn out to be a problem to the patient instead.
The research says immediate introduction to ARVs could be fatal. Dr. David Mayer of the Makerere University College of Health Sciences says that having taken a special interest in HIV and meningitis for close to 10 years now, he had noticed something about HIV-positive patients with meningitis.
So if you had 10 patients, for example, who had this fungal meningitis, about 5 to 7 of them would probably die.
In 2010, when the Training Health Researchers into Vocational Excellence in East Africa project, THRiVE, called upon young researchers, Dr. Mayer qualified and with his team started researching how to reduce the deaths of HIV patients who contract meningitis.
And so in this clinical trial that was in Barara, Mulago, and another site in Cape Town, we planned to enroll 500 patients who had come in with cryptococcal meningitis. And so the idea was that some of those patients would be, just by random selection, would start their antiretroviral drugs while they were still in hospital. So maybe 7 to 11 days after we had made the diagnosis. And then we were supposed to randomize the others to starting antiretroviral drugs about 4 to 6 weeks later, after they had been discharged and had sort of come back to the clinic.
In 2015, the team found that it was dangerous for HIV-positive people infected with meningitis to be introduced to ARVs immediately. The World Health Organization has included this research in its treatment guidelines.
We have shown today to ourselves and the outside world that actually Africans, given the best opportunities, the best circumstances around them, with the best support, good supervisors and trainers, that they can produce wonderful work, and therefore gradually become research leaders of recognition internationally.
With funding from the Wellcome Trust in the UK and partnering with Cambridge University and the London School of Hygiene and Tropical Medicine, THRiVE is turning this into a program to help young researchers.
So at the end of the day, the population benefits because we are addressing critically important health challenges in our own environment.
The team wants sensitization about the guidelines across the country, as many lives have been saved by the research.
I think the natural tendency for the doctors or nurses who see these patients, obviously, is that you want to start this antiretrovirus because this person has a CD4 count of 20 and you want to see them started on antiretrovirus. But unfortunately, in doing that, that can be harmful.
Irene Namialo, NTV.